Hey everybody, welcome back. This lesson is about the most common facial fractures observed in CT imaging. Any of the facial bones can be fractured in any number of ways, but some facial fractures are more common and some are given special names. That's the focus of this lesson. We'll start with nasal fractures. Nasal bone fractures are the most common fracture of the face. They commonly present with other fractures or injuries. In this patient, we can see multiple nasal fractures. There are fractures on both sides of the nasal bridge, but the nasal septum is intact. This could be considered a comminuted fracture because there are numerous bone fragments. A coronal reformation on the same patient demonstrates the same injuries. There are numerous fractures throughout both plates of the nasal bone. The cartilaginous portion of the nasal septum does appear deviated, but it is not fractured. The next fracture type is mandibular fractures. Mandibular fractures are the second most common fracture of the face. They are typically simple and multifocal. Simple means that they are linear fractures without significant comminution or displacement. Multifocal means there are multiple fracture locations. Mandibular fractures often appear with multiple fracture points because the mandible is a partial ring. Any ring-shaped structure will typically break in multiple locations, but not always. In this example, the patient has experienced a simple linear fracture on the right side of the mandible. There are no fragments and there is minimal displacement. The same injury is demonstrated on a volume rendered image. This volume rendered image again demonstrates a linear fracture on the right side of the mandible with no fragments and minimal displacement. The next fracture type is much more serious. This fracture type is called a zygomaticomaxillary complex fracture. Zygomaticomaxillary complex fractures are a traumatic injury to the face, resulting in displacement of the zygomatic bone. As the name implies, this fracture is characterized by a disruption in the suture between the zygoma and the maxillary bones. This fracture type will also always include a fracture of the zygomatic arch, commonly at the suture between the zygoma and the temporal bone. This volume rendered image represents a classic case of a zygomaticomaxillary complex fracture. There is a fracture line within the inferior orbital margin at the zygomaticomaxillary suture. There is another fracture line within the zygomatic arch at the temporozygomatic suture. We can see the same injuries in sectional images on the same patient. In the axial image, we can actually see three different fracture points. There is a fracture on the anterior surface of the maxillary sinus at the zygomaticomaxillary suture. There is another fracture on the lateral wall of the maxillary sinus, still part of the zygomaticomaxillary suture. Finally, we can see the fracture line within the zygomatic arch at the temporozygomatic suture. This combination of three separate fracture points surrounding the zygomatic bone is why zygomaticomaxillary complex fractures are sometimes called a tripod fracture. There are at least three separate fracture points that dislodge the zygoma from the rest of the face. In the coronal image, we can see two fracture points. We can see a fracture in the maxillary wall at the zygomaticomaxillary suture. We can also see a fracture in the roof of the maxillary sinus, or we could describe this as the floor of the bony orbit. Both of these fractures are part of the zygomaticomaxillary complex fracture, but they are also given their own special names. This fracture through the zygomaticomaxillary suture is a diastatic fracture. A diastatic fracture, or fractured diastasis, involves the separation of bones along a suture line, such as the cranial or facial sutures. Zygomaticomaxillary complex fractures typically include multiple diastatic fracture lines because they are occurring at the sutures. This fracture in the roof of the maxillary sinus is also given a special name. This is called a blowout fracture. A blowout fracture is caused by a direct blow to the eye, causing the orbital contents to burst or prolapse through the roof of the maxillary sinus. This image demonstrates the normal appearance of a blowout fracture. The soft tissue contents of the orbital cavity have prolapsed into the maxillary sinus. We can see these same kinds of fractures on a different patient. This is another example of a zygomaticomaxillary complex fracture on a different patient. In the axial image on the left, we see a fracture line within the anterior wall of the maxillary sinus at the zygomaticomaxillary suture. We see another fracture on the lateral wall of the maxillary sinus, and we see a third fracture line within the zygomatic arch near the temporozygomatic suture. Several fractures are also observed in the coronal reformation on the right. We can see the zygomatic bone has been dislodged from the face because of fractures at least 3 different points. We see a fracture in the roof of the maxillary sinus. There's another fracture in the anterior lateral wall of the maxillary sinus, and we see a third fracture at the suture between the frontal bone and the zygomatic bone called the frontozygomatic suture. These complex fractures are almost always caused by trauma. The next type of fracture is also caused by trauma. This is a class of fractures called LeFort fractures. LeFort fractures are a traumatic injury to the mid-face, resulting in complete separation of a portion of the face from the cranium. They are sometimes called floating face fractures. LeFort fracture lines traverse the maxillary sinuses or the orbital cavities. These fractures have varying degrees of severity. LeFort fractures are classified as types 1, 2, or 3, depending on the structures involved. In all types, there is a continuous fracture line through the midface that separates the bones of the face from the base of the cranium. This patient is an example. There are fracture lines on both lateral walls of the maxillary sinuses as well as both medial walls of the maxillary sinuses. If we move posteriorly, we can see this fracture line continues all the way through the midface. In this image on the same patient, we can see the fracture line continues through the pterygoid plates of the sphenoid bone. Fractures of the pterygoid plates is always present in all LeFort fractures. The pterygoid plates help to anchor the facial structures to the cranium. So when these plates are fractured, the face is no longer structurally connected to the cranium. Similar injuries can be observed in a different patient. These images are coronal reformations at 2 different positions on the same patient. In the image on the left, we can see a fracture line that crosses through both maxillary sinuses. In the image on the right, we can see that the fracture line continues all the way through the pterygoid plates of the sphenoid bone. Those are characteristic features of LeFort fractures. Thanks for watching. That's been a review of the most common facial fractures that we observe in CT imaging.